Hi everyone, this is Rahul Joshi, and today we're going to discuss an MCQ on Hepcidin, the effects on Hepcidin by an infection, and the further effects of the change in Hepcidin levels. The question is: a 50-year-old male patient with a Haemophilus influenzae infection will show what kind of change in Hepcidin levels in the blood, and what will be its effect? What will be its effect? The options are increased hepcidin, and this will work against the bacteria, that is Haemophilus influenzae. The second option is the increased hepcidin in the body, and this will damage the host tissue. The increased hepcidin will damage the host tissue. The third is the decreased hepcidin. This will cause the damage to host tissue. And the fourth option is the decreased hepcidin levels in the blood. The hepcidin will decrease, and this will work against the bacteria, Haemophilus influenzae. So, to solve this question, we must know the effects of hepcidin normally. The effects of hepcidin are that if this is the intestinal mucosa, the Fe iron is absorbed in the form of Fe2 plus in intestinal mucosa, and from here a transporter ferroportin transports iron to blood vessels, to blood. But here the iron is present in the form of Fe3 plus. This happens because hepcidin and ceruloplasmin, these are peroxidases. These oxidize iron. Oxidation occurs, and Fe2 plus is converted to Fe3 plus while this is transported to the bloodstream. So the main thing here is, for this question, is this ferroportin is a transporter of iron from the intestinal mucosa into the bloodstream. What hepcidin does is, hepcidin is produced by liver, and this hepcidin binds to ferroportin and degrades ferroportin. What you will think that will happen because of degradation of ferroportin? Yes, it is very easy. If ferroportin will degrade, if ferroportin is not present, then how will this absorption to blood occur? Therefore, the effect of hepcidin is that hepcidin inhibits iron absorption from intestine to blood. Therefore, hepcidin effect is that it degrades ferroportin, therefore blocks the transport of iron. Therefore, if hepcidin is increased, then iron in blood will decrease, and if hepcidin will decrease, then iron in blood will increase. Now, in infection stage, that is the infection of Haemophilus influenzae like bacteria, what happens is, like we know that acute phase reactants like CRP, etc., they increase, and they are produced by liver. They are increased during infection. The positive acute phase reactants increase during infection. Like this, the hepcidin level also increases during infection. Thus, we have known as a fact that hepcidin increases during infection, and this will help us eliminate two options from this question. So, decreased hepcidin is wrong. In infection, hepcidin will increase, therefore these are eliminated. Now, two options remains, A and B. We have known that hepcidin will increase, but what will be its final effect? Will it damage the host tissue, or will it work against the bacteria? From common sense or common knowledge, we can know that our body will try to protect ourselves from an infection. So, by common sense, we can just take this option correct, that it will work against the bacteria, because it is increased by our body itself, not by any other agent. It is increased by our body, that is liver. It is increased in the liver. So therefore, the option A by common sense will be correct. But is it really true that it will work against the bacteria, or will it damage the host tissue? We will see now. If hepcidin will increase your infection, then what will happen is, we have seen if hepcidin increases, then iron decreases. Now what you will think will happen? This iron decrease, will it protect ourselves from the infection? Can this happen, or will it harm our body? The answer is that iron is required by Haemophilus influenzae like bacteria or any agent for growth and development. Therefore, now it is very clear that what will happen if iron is required by Haemophilus influenzae like bacteria or any other agent, any other insulting agent for its growth and development. Then if hepcidin is decreasing the iron, if hepcidin is increasing in infection and decreasing the iron level in the blood, then the iron for the bacteria like Haemophilus influenzae will not be available for its development. Therefore, if iron decreases, then Haemophilus influenzae's growth blocks. Therefore, the answer is increased hepcidin, and this will work against the bacteria. Option A. Thank you.